Truly He is the one, He has no father or son.
Truly He is the one, He has no father or son.
Everything in creation.
Our first lecturer, if you are conversant with RTV, is someone you know, and he will be discussing seizures in children. He is a medical director, and I think the owner of Children's Specialist Hospital, 59A, Albert Johnston Crescent off Adeniyi Jones Avenue, Ikeja. He is also a consultant pediatric neurologist, Department of Pediatrics, Lagos State University College of Medicine, also known as LASUCOM or LASU to some people, and he is no other than Dr. Muhammad Salisu.
Okay. Assalamu alaikum warahmatullah. Well, what I'm going to do is just to try and give us some few words with respect to a problem that you'll be surprised if I tell you is very common. But as common as it is, people continuously are taken by surprise. And unfortunately, most of the time, the responses that people make are usually disastrous. So probably if in the few minutes that I have, I try to give us some basic background knowledge about this matter, then it probably will help us and help people who we will be talking to subsequently. So we'll be talking about children having seizures. And there are just three basic definitions you need to understand here. The root word is the word seizure. And what is interesting about this, irrespective of what you've seen me put on the board, I want you to picture your home and picture NEPA. When you are lucky, you will have light. Isn't it so? But there are some times you will wish that there was no light at all. Why? Because probably the light that they brought is even worse than when there was no light at all. Because if somebody now asks you, there's something on television, put on the TV, are you going to say that you don't have light? When the light NEPA has given you is worse than a candle. So what do you usually say? You will say, low voltage. Is that not so? Now, that one is also nice. The one that is the problem really is the one when the fan that your great-grandmother handed over to your grandmother and to your mother, and when you were going to your husband's house, you were given that fan. It has been in your family for generations. And you know that at least when you put it on, after 30 minutes, then it will make the first movement. After another 30 minutes, then it will just occasionally, you say, okay, fine, here one bear. But suddenly, NEPA decides to bring light. And then you think that you have an air conditioner in your house. Because the fan is just doing what? Going very, very fast. And then everybody starts running helter-skelter. Hey, and then you say, what has happened? They say, NEPA Tishekini want to be high voltage. So really, when you talk about seizures, you are actually just saying that there's high voltage in the brain. That's all you need to remember. Because the brain operates with electricity. So once you hear that somebody has seizure, it means that that NEPA in the brain is doing high voltage. And how do you now know that there is high voltage? One of the ways it will manifest is you find the person jacking. That jacking is what you call what? Convulsion. But sometimes the fellow is not jacking. Sometimes he just loses consciousness. Some other times you find the fellow doing funny things. He just starts doing, he just licking his lips. Or sometimes he says, I'm feeling something. And you're like, what are you feeling? Something. And you're like, I hope this guy is not going mad or something. Or you find situations where the fellow can just start vomiting. Or the fellow is sweating. Or the fellow tells you that my stomach is doing me one kind. Or you find the child suddenly run to you and grab you. And he does this recurrently. Or you find, which is the reason why a lot of people ended up in psychiatric hospital, you find somebody telling you, it's coming, they are going, they are following me, they are doing this. All these things are different ways by which high voltage in the brain can present. But the one that most of you are used to is that one where you find a part of the body or the whole of the body jerking. That is the one that is called convulsion. Now, the last one, which a lot of people see more often, but then confuse, is a situation where you find that the operative word is somebody who is having high voltage in the brain in a recurring manner. And you cannot say why this is happening. So once you find somebody having a seizure more than once, and you cannot find a reason for it, then you call it what? Epilepsy. So you can see that the only basal root word for all this is the seizure. You cannot call convulsion seizure. You cannot call epilepsy seizure. Whether it is convulsion or epilepsy, they are all forms of what? Seizures. So you often find people will be saying, oh, convulsion loni kò ní seizure. Epilepsy loni kò ní seizure. The moment you say somebody has a convulsion or the fellow has epilepsy, what you are saying is that the fellow has a seizure. What makes it a convulsion is that that seizure is manifesting with jerking of the body, which can be just one hand or the whole body or just the eyes or just the mouth, whatever. Epilepsy is when the high voltage continues recurrently. Do you understand these definitions? Once you understand, then I actually have finished and I can go and sit down. But need to understand a few other things. We often will hear amongst doctors and nurses and pharmacists that they will say, oh, the seizure that fellow has is acute. Or the seizure that fellow has is chronic. You will soon understand another reason why there's a distinction between seizure and epilepsy. Using the word acute and chronic. Very often, when you hear that somebody has had an acute seizure, it's very likely somebody who has never had that problem before. It's very likely that the fellow probably is having a high fever. It's very likely that the person has been ill for some time. It's very likely that the person fell down from a height. It's very likely that somebody took a stick and hit him on the head. It's also very likely, which is the one that people are usually afraid of, that when they go and do an MRI, they say there's a tumor in the brain. So the real thing about acute seizures is the fact that it's a sudden event for which you are often able to identify a trigger element. As compared with the chronic seizure, which has two things that characterizes it. One is the fact that it is recurrent, And the second one is that you are most often unable to find the reason why. Are you with me this far? Fantastic. Now, the first one, which is the acute seizure, I've tried earlier on to give you a few common causes. I've spoken to you about fever. And when you find children 5 years and below, usually between the age of 6 months and 5 years, but occasionally you could even find in a child who is 3 months, child has a fever. Maybe he was having a runny nose for some time. Maybe the child was crying when you pull the air. Maybe the child has a pneumonia. Maybe the child has a urinary tract infection. Maybe the child had boils. Whatever reason, the child has a fever. The next thing, the child convulses. That is what they call what? Febrile convulsion. That is the one many women who have children have had to deal with. Infections in the brain, such as meningitis, cerebral malaria, don't worry about that third one. Head injury, I've spoken about. That's why you've heard of people falling down from a height and they convulse. Or a child fell down on the playground, you take the child to the hospital and you find the doctors asking you the question, did the child convulse? You find the doctor asking the question, did the child vomit? Those are indicators of injury to the head. Poisons, metabolic problems. For example, a child has been ill and has not been eating and even has been vomiting. The sugar level is low. That could make the child to convulse. Drug overdose, intoxication. Sometimes a child has fever and you go and get one agbo. Maybe it's agbo jedi or agbo iletutu or whatever names that you guys have. Unfortunately, these are things that have certain chemicals in them that kind of like eat up the sugar in the blood. And when the sugar in the blood is low, just as I have said here, then the child will convulse. Why? Because the brain requires just two things. It requires sugar in the form of glucose and it requires oxygen. Now, the other one, which is the recurrent one, which people also often talk about, is the one called epilepsy. Now, what you've seen here are a list of possible reasons why there is epilepsy. What is important that I want you to take away from here is not so much as all of this, but to understand two things. That one, when we say epilepsy, out of every 10 cases, we will not find the reason in 7 of them. So when you come to me, for example, and a diagnosis is made about your child, or your sister, or your cousin, or even about you, and then you now say, doctor, so I have epilepsy. I say, yes. I say, so doctor, what is the cause? Because people often believe that when you find the cause, then you find the solution. Is that not so? They say 50% of your problem is solved when you know the problem. Is that not so? It doesn't go that way with epilepsy. Because in the first place, 70% of the time, no matter what you do, you cannot find the cause. The second thing I now want to say about that is actually to give you good news. Even though I will investigate to find the cause of epilepsy, the secret is that I am praying not to find one. Some of you will say this man must be mad. Because for those who have had me investigate or a doctor investigate for epilepsy, it is not cheap. One test that they do of all the tests, which is the most expensive, is called an MRI. The MRI costs 77,100. And you see me telling a mother, I want you to do this test for your son. It is 77,100, but I don't hope to find anything. What are you going to say? if I tell you such a thing. Even if the test is 5,000 naira, and I tell you that I don't hope to find anything there, I'm sure the next thing you say is that, is that not what you are going to say? The Jebu in you will be like, Kilafe waste to. But the truth of the matter is that you should pray that I ask you to do it. You should look for money to do it. And then pray that I don't find anything. You know why? Because most of the time, the ones that respond best to treatment are the ones that which you've looked for the cause and you cannot find it. Most of those ones that you look for the cause and you find it and you say, Alhamdulillah, Dr. Tirin Koton Shomomi, sorry, I am not able to cure it. Take, for example, there's one abnormality in the brain. They don't do epilepsy surgery in Nigeria. So even if if it's an abnormality that can be removed, it means you have to go to South Africa, means you have to go to India, go to Europe, go to America to go and get it operated. And most often, those abnormalities, as I have said, even when you find them and you try to treat them, you do not sometimes succeed. And even sometimes when you do succeed, there still will be some residual problem. I hope you followed me this far. Before I leave this slide, I want to make mention of something. This first one I wrote, I said genetic conditions. Those of us who are Yoruba, as I believe the majority of you here are, you probably will have heard that statement. When you say you want to marry one girl or marry one boy, they will say, Shetilo yewon wo nile won. Is that not so? You hear things like, She won ni warapa ni family won. The truth is this, that funny enough, even though the Yorubas didn't go to medical school, they have some logic in what they have said. But the way you have a genetic association with epilepsy is not the same as you say one person who is AS, another person who is AS, then automatically they have a child that is SS. It doesn't matter anything else. Is that not so? Or if you have one SS, all their children will be what? SS. With epilepsy, it is not that simple. Even when you have what you call the genes in the system, there are so many other factors that need to be present. Some of it is environmental. Are we together this far? So when it comes to the issue of your choice of a spouse, please don't categorically say, because that person has convulsed before, then maybe I should tell you, I have convulsed before. I have convulsed before. Let me shock you further. When I had my own convulsion, it happened inside the market. And I'm sure you know how Yoruba people feel about the market. Is that not so? Like when they say, Eyon Yawere, it is bad enough, Eyon Yawere. But once I wake in, ẹ má jẹ́ kó já. Torí tó bá ti fi lè já, tó bá ti dé ọjà, kò ní kí ọmọ. Is that not so? Ó dàbí pé wèrè tèmi, ó ní kí ọ, even though it happened in the market. And I am not deceiving you. It is the truth. I had a convulsion at the age of 11 years because I used to often have malaria. So if I have come this far and you think that I have tried, then before you start to say you won't marry that sister because she has convulsed, or you won't marry that brother because she has convulsed, you may be missing the best thing in your life. It is therefore better that you ask more information. So, how do people present with seizures? Sometimes it's the whole body that jacks. We call that generalized. Sometimes it's a part of the body. We call it focal or partial. Sometimes this one they call absconsis. The way I used to call it is otepos. You know those days when they started with all this video, whatever, when you are watching an interesting film and the urine is coming, you want to urinate, but you're like, mo fẹ́ wo scene yẹn, mi ò fẹ́ miss it. But when videos came, you now say, jọ̀ọ́ mi tẹ pause. So even if the guy was carrying a hammer and he was going to hammer somebody, by the time you press pause, if you go and urinate and come back, the fellow is still like that. Is that not so? So it's the same thing. When you say somebody has an absence seizure, what you are saying is that when that thing happens, so if I did like this when talking to you, I'm just like that for a few seconds. And because those seconds are so few, it can be as few as 5, 10. You may miss it. So if it is your child, you just see that maybe your child was talking to you and the child is saying something like, and he just gets stuck like that. Those are called absences. Then there's what you call the neonatal seizures. That is children from birth until 1 month of age. And then, of course, I've spoken about febrile seizures. I have 5 minutes more. Now, so what do you do when you see a child with a seizure? Very simple. Remember ABC. A means that please try and ensure, because sometimes the person may have vomited. Sometimes the person was eating when it happened, and so there's something in the mouth. So what you need to be doing is try and look at this person's mouth to be sure that the mouth is clear. Second thing is B. A for airway, not A for apple. It's not B for ball, but B for what? Breathing. You want to be sure that this person is breathing. And of course, the C for circulation. All you need to do is you just feel the pulse at the neck or at the arm and see whether, or even put your ear to the heart and see whether the heart is beating. Once those things are happening, then you position the child properly. Place on the side, preferably the left. If it is the right that is convenient for you, fine. And I will show you a picture soon. Loosen tight clothing around the neck and immediately start to time the seizure event. Seizures usually last less than 5 minutes. It doesn't matter the drama. The guy can be dancing like Michael Jackson, Justin Bieber, MC Hammer. Doesn't matter. Just time it. Do you get what I'm saying? Just time it. You will be surprised. He usually, in over 80% of the times, is less than 5 minutes. Then, if the fellow has a fever, tell somebody to bring towel, put in water, squeeze, and you mop the body. So you can see about the airway, breathing, and circulation. Also make sure you don't leave the patient alone. Place the patient on the side and make sure there's nothing in the mouth. You see the positions that you can do. The fellow fell down like this, and then you just slowly bend, keep one leg straight, then bend the other leg, bend the arm, and then just twist the fellow to the side. So this is the preferred position to put anybody, child, baby, adult, who is convulsing. Because if the fellow had anything in the mouth or was going to vomit, then he vomits it out rather than taking it in as an aspiration. Now, what else do you do? After the seizure has stopped, let the child lie down to rest until he's fully conscious and back to his normal self. You may then take the child to hospital after this for a doctor to have a look. If this is a habit, that means the child has been doing it. It is a regular event. There is no need to rush to the hospital. Just document this incident for the next clinic appointment. If, however, the seizure goes beyond 10 minutes, make sure you proceed to the hospital immediately. What should you not do when a child is having a seizure? 1, do not try to put anything into the mouth. I'm sure you can see. There are some people who are specialists. Efiri, alubosa, agole tutu, otapiapia, all those kinds of things. All those things are not necessary. Do not attempt to force the mouth open. What I always say is that ṣé òun ló panu èdè fúnra rẹ̀, òun náà ló máa farabalẹ̀ ṣí. Don't worry, Shakara, it will stop. The only time you need to bother about the mouth is when the child clamps the teeth and the tongue is in between the teeth, like this. That time, because of the force of the teeth, it can cut that tongue. So what you then need to do, get a teaspoon, wrap a cloth around it, and try to open the mouth from the side so that you can push that tongue back inside. And then remove your spoon and let him continue with his Michael Jackson. Very often I find mothers who come and say, Doctor, and I say, you are not being a mother by putting your fingers inside that child's mouth. Not only can the child cut your finger and then you become kuturu, the other thing that can happen, the child can swallow that your finger. If he swallows it, it's even good. The intestines will digest it. But it can go into the child's lungs, and that is what will kill the child. Do not attempt to physically stop the child from jerking. Let him jerk as much as he wants. Do not apply any lotions or balm or oil or heat or anything. Just do what I have said the first time. Do not immerse the feet or any body part inside fire. Do not attempt to use incense, smoke around the child's nose. You will only suffocate and kill that child. So, the child has stopped. You have washed all these things. You have made sure there's no vomiting. You've cleaned the mouth. The child has finished convulsing. Maybe it is the first time. You now take the child to hospital. Or maybe it is going longer than 10 minutes. Then you take the child to hospital. But like I have said, in 80% of the times, it's less than 5 minutes. There is nothing super in you. The child is convulsing less than 5 minutes. You carry the child. The body is like that. You are rushing 419. You rush across the street. A car hits you. Okudimeji. Even you that you are the one carrying the child, you are the one the car will hit. The child will fall on the side, finish his convulsion and wake up. And then you are there. They carry you to Gobi. And then again, when you are carrying the child convulsing and rushing like that, that's when the child can vomit, aspirate, and die. Convulsions do not kill. Only 2 things happen that usually result in convulsions killing people. The commonest is when they vomit and aspirate. The second one is when they have been convulsing continuously, hours non-stop.
All praises and gratitude is due to Allah subhanahu wa ta'ala, the controller of all affairs. Admonition Islamic Center hereby expresses solidarity with Nigerians at this critical moment of our nationhood due to the scourge of COVID-19 globally. We especially feel for the Muslim Ummah, who from all indications will have to start the 2020 Ramadan season in complete lockdown. There won't be Taraweeh, no physical tafsir sessions, no joint iftar, no itikaf, and possibly no Eid al-Fitr prayers. For the same reason, the AIC is supposed to be 10 years this year, and arrangements have been concluded to feature 10 guest speakers for 10 hours at the prestigious National Art Theatre Igomu, Lagos on Saturday 2nd May 2020. But by Allah's will, it will not hold again. We take solace in the fact that Allah is the best of all planners and He alone knows best. We beseech Allah to spare our lives till next year's Ramadan 2021, inshallah. We pray for Allah's forgiveness, that Allah heals the world, put an end to this pandemic, and give us the privilege to be together for His sake again, to witness more Ramadan in good health. Ameen. Inshallah, our focus this 2020 Ramadan in our own little way is to provide foodstuffs to the fasting Muslims who are in need. May your rewards be great with Allah as you join us to make this dream a reality. For inquiries, call 0802-335-5870, 0808-690-5870, or 0708-378-7920. Account details: Admonition Islamic Center, Bank, Sterling Bank, account number 050-021-1796. Lukman Adekombi for AIC. Ramadan Mubarak.
Ramadan, Ramadan, ya Habib.
So I have jumped. This just gives you an idea what the doctors do. They stop the seizure if it's still going on. They make sure of the ABC like you did. They give IV fluid and medication as appropriate. They take the story from you. They investigate the cause, administer appropriate treatment and counseling, discharge home to follow up. Now, these are just pictures. You can easily see, for those of you who have had anything to do, when they are investigating a child that has had a seizure, there's a common test they do. This is called an EEG, electroencephalogram. These are the stickers that they will put, and the wire goes and attached to the machine, and it reads the electrical activity in the brain. This is what you will see, all these worms. These things have a meaning. These ones, just take my word for it. If this is what you see in your child, that is normal. I forgot, I should have put what is abnormal there so that you can also see. Now, myths about seizures. People say that seizures are infectious. Majeki ito ekon. It's not true. Witches and wizards, it's not true. When you eat lizard, scarification marks, concussion. If you want to eat lizard, eat lizard. Don't use convulsion as an excuse. And according to some people, I'm told that lizards are very sweet. So if you want to find out, don't wait until you have convulsion. Just pick the next lizard you see and eat it. But don't force the poor boy to eat lizard. Don't do scarification marks. You only make the child ugly. Another myth is that they say is the result of something that the mother did or did not do in pregnancy. That is not true. Another one is that there's no such truth. Are seizures curable or preventable? Yes, but prevention is for those causes that are known and can be avoided, e.g. infection. Cure is for those causes that are known and you can remove, e.g. tumors or bad parts in the brain. It makes sense, isn't it? Cure can happen even when a cause is not known or cannot be removed, but the child responds very well to appropriate medication for the duration prescribed. This is the category that you should pray for. Most seizures can be cured. You see, I used the word under parenthesis. Time will not allow to explain further. You people understand cure in the context of Oshemi ko shemimo. So we can treat epilepsy in that way. Oshe afuelogun ko shemo, fine. But there's a story between it. The moment they start to treat anybody, baby, adult, child, for epilepsy, the minimum you expect that treatment to last is 3 years. Because the truth of the matter really is that it is not like malaria, where you give anti-malarial. It's not like bacterial infection where you give antibacterial that goes to kill the parasite. There's no parasite to kill when you are treating seizures. What you are actually doing when you are giving medication for seizures or epilepsy is that you are giving medication that kinds of like helps the brain to rewire itself, to make the brain less susceptible to high voltage, because it is high voltage that is causing the seizure. So you reduce the sensitivity of the brain to high voltage. And we found out that those drugs do that, and the drugs need a minimum of 2 years continuously without seizures. If that has happened, then we assume that that has happened successfully. And then you withdraw the drug over another 3 to 6 months. So you can only start counting from the moment when the seizures have stopped. If, for example, you start January 1, and from the moment you start treatment January 1, the child does not convulse again, then January 1 the next year makes 1 year. January 1 the next year makes 2 years. Then you have another 3 to 6 months that the doctor withdraws the drug slowly, and then at the end of that 2.5 years, he congratulates you and say your daughter or your son is cured. Do you understand? But sometimes, and in most people, it doesn't happen from the first day. It may take 1 month, 2 months, 3 months, 6 months, 1 year before the convulsion stops totally. What you may notice is that it starts to reduce either in duration or in frequency. So we always want to assume that it will take 6 months before the convulsion stops. It may happen earlier, it may happen later. So if you had 6 months before, seizures, no seizures for 2 years, and 6 months after, how much is that? 3 years. Do you understand what I'm saying? So please and please, either for you or anybody you know, if anybody you know has been diagnosed to have epilepsy, a baby, a child, an adult, and then you find a doctor tell you that he has cured it in 3 months, I think he's telling you that he doesn't know what he's doing. You better go somewhere else. Some treatments may require other processes, such as special diets, surgery, and implantation of medical devices. What am I saying is that sometimes medication is not enough. Sometimes you need to operate. Sometimes you need to place the person on some special diet. For you to understand that this is not small business, I have been with people who for 45 years of their life, all they were doing is treating children with seizures. So if you think it's a very simple matter, it is not a very simple matter. But it becomes simple when you go to the right people who know what to do. Some seizures may appear to be resistant to all available treatments. And this is the way you understand it. Whereas the goal of abolishing seizures is achieved in up to as high as 70% of cases eventually, sometimes this may be adjusted to reducing frequency to as much as is possible. What I'm saying here, dear brothers and sisters, is that for every 100 people who have epilepsy, take my word, 70 of them will be cured. Whether it will happen in 3 years, or 5 years, or 10 years, or 20 years, they will be cured. Whether it will require only 1 drug, or 2 drugs, or 3 drugs, or drug plus special diet, or drug plus surgery, or drug plus implantation, 70% will be cured. But there will be 30% who will not be cured. They will get relief to different degrees. Some of them, significant relief, but they know that they can still convulse, maybe once a year. Some, maybe they used to convulse 10 times a day. It reduces to 4. You may say, Otipoju. Well, but 10 and 4, what do you think you should do? So please understand that fact, that you may not get that. That is, I'm even giving you statistics when you have gone to the right people. And I'm emphasizing this so that you cannot but know that you must go to the right places. You must go to see the right doctors. And when you find a doctor doing abracadabra, then it is time for you to leave that particular doctor. And sometimes the doctor is also doing the right thing, but because you think, I think logun for 3 months now, kò tí stop. Ó ti stop tẹ́lẹ̀, ó tún ti padà wá. Please understand these procedures. Now, in the days when I was a student, you have to be 8 years old before your head is big enough for what they used to do, the seizures, the EEG. But you can see, this baby is less than how old? I even have another one that is like 2 weeks old. We just stick it. That's the mother, that is the baby, that is the machine. And so this is what they use to stick it to the baby's head. Assalamu alaikum wa rahmatullahi wa barakatuh.
I must state the fact that what he has done in about 35 to 40 minutes, people pay millions of naira to get that knowledge. People pay thousands of dollars to get that knowledge. I have a friend in Brighton University, England, and she's studying pharmacy. A fee per year is 15 million naira when you convert it. That was about 2012, 2013. And now we know the increase in dollars. So I'm wondering how much she's paying. And she is studying pharmacy, not even deep into the medical line. And he has given us a lot in about 40 minutes. We say Jazakumullah khairan to him. Now, I must highlight what he has done. He has given us the definition of seizures, differences between seizures, convulsion, and epilepsy, types of seizures, causes, do's and don'ts when your children are in that stage. Is it curable or not? Is it preventable or not? These are the things he has done for us, and we really, really thank him. Now, I have been asked not to rush our speakers, but then we need to balance that scale. So I will not be able to take much questions from the audience. I will just be allowing two, one from our brothers and one from our sisters.
Assalamu alaikum wa rahmatullah. Yeah, my question is, how valid is the argument that constant consumption of painkillers would result into seizure?
How valid is the argument that constant consumption of painkillers will result in seizures?
Yes.
Please, let's take all the questions together so he can.
Assalamu alaikum wa rahmatullahi wa barakatuh.
Wa alaikum salam wa rahmatullahi wa barakatuh.
Sometimes ago, I had an experience with a child of 5.5 years. And what happened was, he was diagnosed of a brain seizure. But at the end of the day, series of tests were done, ECG, this, and that. Later, the doctor, pediatrician, now mentioned that a drug that is recommended that until when the child got to age 7, that is when the whole thing will go. But the question I need to know, because I inquired from the pediatrician, but I don't understand. What are those things? Apart from what our speaker just mentioned, that painkiller, what are those things responsible for brain seizure of child?
Assalamu alaikum wa rahmatullahi wa barakatuh.
Sorry, I counted just 2 hands.
Assalamu alaikum. All of us know that too much of anything is bad, isn't it? If you drink too much water, you can have seizures. Do you agree to that? Or are you aware of that? If you dispute, when it's time for iftar, just start drinking water. Even when your tummy tells you that it's enough, just continue to drink and say, Kilomba misoy. So, honestly, generally speaking, too much of anything is bad. So when you say somebody is constantly taking something, my natural understanding of that is go to abuse it. And as a general rule, when you're then talking about painkillers, there are 2 categories of painkillers. There are the ones that in a sane country, you can buy off the counter. And there are those ones that you can only get as prescription drugs. But you see, even Panadol, when you take Panadol to a point and you have abused it, there are sequences of what it can do to your system and of the many things that it can do. Because, okay, now this is the way you need to understand it because of time. Painkiller relates to the nerves. The nerves, one way or the other, will relate to the brain. So, if the medication you are giving to treat, the control is in the brain, it means that that drug must be going to the brain. Is that not? So, when the concentration of the drug is too much, what is going to happen? If you eat too much rice, you can convulse. If you eat too much beans, you can convulse. So, that is just the operative word. Where it becomes a problem, however, is when you are taking a medication in appropriate dosages as given by the doctors. You now say, is it true that such can lead to seizures? You see, the truth of the matter is that that is not common. That is rare. And in situations where those things can happen, the doctor prescribing such a drug to you would have told you. Do you understand? So as a general rule, any medication that you are going to be taking and has been properly prescribed to you, it is very unlikely when you follow rules that you will convulse. So just discountenance that concept. The second question was asking about, most of what he said, I really didn't get. But you were just talking about a particular or a specific patient. And unfortunately, we can't be discussing that one here. You see that I was given 25 minutes. I spent 40 minutes. I was even congratulating myself. Because when I'm giving lectures on this to students, it takes 3 lectures. And each one will take about 1.5 to 2 hours. So how do I talk to people using basic information in a way and format that they can understand? I thought I tried. But having said that, that particular questionnaire, if you have a particular child with a specific problem, it's better we discuss that one outside of this place. Then you ask the question about causes. That means you came late or you were not listening. Maybe it was that period in time when your sugar level went down. And so you didn't really hear what we were saying. So you can talk to me outside. Assalamu alaikum.
Wa alaikum salam. Islam has asked us not to be partial. And my mom in the house was the first to raise that hand. So please, after our question, any other question, it is either you pass it to me and I give it to him and he will answer you personally, or you see him after. So for our subsequent lecturers, we'll be taking just 2 questions.
Yeah. I actually want to admonish our lecturer. I'm very grateful. I found out that what we have talked about is very great. And so many people fall a victim. I was a victim. That is my child in 2004. And I feel that time it was an ignorance because we were not enlightened about these things. My child, had frequency with seizures, convulsion when he was a baby before I took him out of the hospital. And they said because they did somehow, the extractor, that they didn't do it very well. It was taken back and then it was brought back to me. At the age 1, he has seizure, convulsion, age 2 and age 3 before he finally gave up the ghost. It was really painful that I had to lose my child. But if I had the right person right before me, I think his life would have been saved. It's just an opportunity for everybody to have a listening ear and a good understanding of what is happening around us. And we should not take any lecture that is coming up like this as a child's play. It was really painful. I really thank you for the opportunity of learning. Thank you very
Who
much.
is the loved one? Who is Ar-Rahman? Who is Al-Mannan?
لا إله إلا الله محمد رسول الله. Muhammad is the messenger to Allah, is our